Great.
Alright, thank you very much for viewing this video. The content covered today is implementation and evaluation of an electronic health record system. Today's objectives are to explain the criteria for an electronic health record system developed by the Centers for Medicare and Medicaid Services. So this is the content covered in Chapter 12 of your textbook. I'll describe how to assess a healthcare facility's readiness for implementation of electronic health record, how to evaluate and create a healthcare facility goals for the HR system, how to examine a migration plan. We'll explain the workflow analysis, understand the cost of ownership of an electronic health record, the evaluation process, and the request for proposal and implementation plan. Finally, we'll assess the stages of meaningful use. To begin, there are some initial steps that any organization should complete when implementing an electronic health record system. There are 4 initial steps. You need to assess the readiness of the individuals and the organization as a culture to see whether the organization is ready for a large-scale change and to see if the people within that organization are ready for the change. Once the decision has been made to accept, to go forward with an electronic health record system, then a steering committee would be formed who would set appropriate goals, and the organization would also set those goals in collaboration with the steering committee. So a steering committee would be established with a project sponsor, which is usually an executive member of the senior executive team. And then a project manager would also be assigned to the project. Next slide, please. Next slide. Organizational readiness is prior to the implementation of the electronic health record must be understood. The following types of resources are necessary to be considered. The capabilities of the existing clinical, financial, and administrative computer applications. So what do we have now in place? What's our current state? What kind of resources do we have to staff a large-scale project such as this? What kind of support do we have in place to help people make the transition, to assist them with the implementation, and then to sustain the change over in the future? We also need to take into consideration the accounting needs. So what kind of data does the hospital need? What kind of reports does the system have to generate? What kind of revenue would be generated by implementing a system? And how would that affect the emergency visits? So we can plan for the ongoing patients, particularly in a family doctor's office, but what about the emergency visits where people sometimes just show up, as they often do in mental health, or in a family physician's office, sometimes people just show up, or they need to get them booked in a more immediate fashion. Cultural considerations of the organization need to be considered. So what are the personal responses to change? How have people adapted and adopted large-scale change efforts in the past? What barriers were there? How did they overcome barriers? What were the challenges? What was the communication plan? And how did people eventually adopt? Who's driving the change? It needs to be considered. Are they an influencer? Is the project manager, does the project manager have the right project management skills? Do we know if this change will be better? What's the data? What are we trying to measure? And a facility must appreciate the difference between implementation and adoption. You can put in the best systems in place, but if people aren't willing to adopt them and to adopt the change and to tweak and improve the change, then the systems will be no good to the organization. Next slide, please. The next step after readiness is the organization must identify the goals of the electronic health record system. So the goals, if you recall, need to be specific, measurable, achievable, and timely. So they must be absolutely articulated, what we're trying to achieve and what data would be used to see if we achieve them. So we need that data to be measured. It needs to be attainable in the sense of a time frame. The time frame must be realistic and in terms of a time frame, and it must be timely. There must be an actual end, a start to the project and an end to the project. And then a sustainability time frame after that, or an optimization time frame after the implementation. Goals will vary somewhat to organization to organization. So the goals of a family physician's office or a long-term care facility may be very different from a large acute care hospital. So the vendor needs to work with the organization to ensure the product that they are suggesting to be implemented must meet the goals of the organization. At minimum, many goals stem from the following objectives. Most organizations want to increase the quality of the patient's care. They want to either increase revenue or decrease costs, depending on whether it's a private facility or a public facility. They will want to also increase operational efficiency, so getting patients access to more timely diagnostic tests, getting clinicians access to more timely communication. And supervise compliance, so we want to also make sure that the information contained within the system is kept private and confidential, and people are using this system as intended. We also want to improve reporting. Instead of paper-based manual processes, if we can data mine and extract data and run reports, it can assist with better knowledge of the system and better knowledge of our patient care. Next slide, please. The next step involves setting up the steering committee. So the steering committee, as I mentioned, should have a number of stakeholders on it. The steering committee also usually reports to an executive sponsor. So the executive sponsor would be somebody on the executive team, like a vice president or a dean, someone very, very senior in the organization. A typical steering committee, though, who reports to this project sponsor, would be comprised of clinicians, health information professionals, administrative, financial staff, and other relevant staff members such as pharmacists, maybe physiotherapy, occupational therapy, or maybe a representative of some of those allied health professionals. This committee comes to consensus on the infrastructure changes that are needed to implement, as well as to identify the steps for the successful migration of the electronic health record. And they usually do that through a project charter. So they develop the scope of the project, what the current state is, what the project is trying to achieve, what's considered in scope in the project, and what's out of scope in terms of we're implementing this but we're not implementing that. It affects these people but it doesn't affect those people. And basically the steps are all laid out in terms of how to implement the electronic health record system. Prior to that, a plan needs to be in place even to select a system. So to have a vendor come to the organization and perhaps do a presentation on what's possible. Or many vendors, particularly if it's a public organization, there may be a request for proposal that's needed. And even prior to that, a request for information for vendors to come forward. There needs to be ongoing consistent meeting times for the steering committee to meet, so they must be established well in advance and they must be consistent so that people can arrange in advance to attend those meetings. Quite often a teleconference will also be set up, or maybe a WebEx video conferencing, so that people, if they can't be present at the meeting, at least they could interact via the WebEx or the teleconference. And at those meetings, and at least initially, the lessons learned are reviewed from previous implementations if there has been one. And it's always good practice to debrief those meetings, to take a look at how did the meeting go, what could we do differently, how could we improve those meetings. Next slide, please. The assigning of a project manager. The project manager is the next logical step for the implementation of an EHR. There are options that the steering committee can deploy. They can hire an internal project manager, or they can go external for that function. And there's pros and cons to each one of those, those directions. So in terms of the internal project manager, that's an individual that tends to know the organization. They know the culture, they know the structure, they know how decisions are made, they typically know what some of the barriers are going to be. They know what the challenges might be from past organizational change efforts. They're usually on site and readily available, just an email away perhaps, or a desk away, or another department away. But they might lack objectivity, and so they will have a vested interest in getting the implementation completed, but that vested interest might also be a barrier to them looking at the project objectively. So what an external project manager does is they bring that objectivity, because they don't know the organization. And that can be a pro and that can be a con for sure. They're often neutral and objective, but they will have to spend some extensive time getting to know the culture, getting to know the structures, getting to know the mission, vision, values of the organization. But on the flip side of that, they're often the person who can ask the dumb question and it not be dumb, because they sincerely don't know the answer to the question. So what that does is prompt other people to think about it. So why do you do it that way? I don't know. We've always done it that way. So that might be an internal person, an external person asking someone internally if that's valid, if that step in the implementation or the current process is actually a valid step. The qualities of a good project manager: they must be very good in communication, so communicating with stakeholders above them and communicating with stakeholders who are going to be assisting on the project team. So they need to be sort of leading up and leading down, as well as leading their peers. They need to be good facilitators, so they need to get a task done, but also run an efficient and effective meeting where people feel involved and that they are heard. They also need to delegate and to ensure that there's always constant follow-up on tasks that have been delegated. So if a task has been delegated to a project team member, there must be a vehicle for the project manager to either receive a report back on the status of the delegated tasks, or perhaps a meeting scheduled. Or perhaps it can also be on the next meeting agenda. It would be a review of the follow-up items. They should understand healthcare and the clinical information and the information that needs to flow to various stakeholders. Next slide, please. The project manager role is to handle all of the issues related to the electronic health records selection and implementation. So they may not do the work, but they handle the issues. Sometimes they're triaging the issue to another person, or perhaps they need to go and lobby for funding, or perhaps they have to get they have to be involved. They have to be involved in the selection of the vendor. So they have to plan out that request for proposal process or the request for information process and seek out the vendors. Issues include the transition from the paper to the electronic health record and managing the people side of change of that, as well as the technical limitations of staff. I know in London, when we implemented our computerized provider order entry system, there was a group of physicians, particularly with my role in training the physicians. There was a group of physicians who came forward and said, I'd like to get to know the technology better before I start entering orders. So we had to put classes on basic Windows training. So what is a window? What is a search field? What is a menu bar? What is a toolbar? What is a right click? Which seems very elementary, but for those who are not used to computers and computer technology, it was very important to get them comfortable first with the tool that they'll be using before they use the software. The project manager works closely with the IT department and the vendor, again, to ensure that the product that they're going to be buying will meet the needs of the organization. And they also lead processes in identifying user roles and manage staff training. So the user role there might be one person who's delegated to manage the request for proposal process. And there may be a project lead for communication, and there may be a project lead for the training. Those would all be project member roles of which the project manager would manage. Next slide, please. So checkpoint, true or false? I'll give you a moment to read that over. So the answer is false. It also includes many other staff, like the administrative staff, financial staff, as well as the clinical professionals and IT staff. Next slide, please. Second checkpoint, true or false? An effective project manager should be able to delegate. Yes, true. They can't do it all by themselves. They are the orchestrators of the orchestra, and so they are the lead at the beginning, at the beginning and throughout the project, and they are to delegate tasks so that tasks are completed. They couldn't possibly do a large-scale implementation all by themselves. Excuse me. They need to give the work to the people who know the work the best. So if we're looking at the pharmacy aspect of the tool, we would involve a pharmacist. If we're looking at the scheduling part of the tool, where we're scheduling patients in, we would involve a medical secretary. They know that work the best, and they do the work now. Next slide, please. The migration plan. It provides the framework and identifies all the steps that need to happen to complete the transition from the paper health record to the electronic health record. And there are 5 typical steps in a migration plan. I'll go over those in more detail. Next slide, please. So the 5 steps are listed on the left-hand side there. To identify the requirements, so the scope of the project, and what the user needs. Will there be more hardware required? Will there be communication needs? Will there be training needs? So what is included and what's not included? Why is it included? We need to create the design, so illustrated blueprint of the paper, from the paper transition to the electronic health record. And quite often what's very helpful is pictures. To take a picture and have a vision of what the future looks like and what the current state looks like. Then we go and analyze the current system. So how do we exactly do it now? And does that process work? Are there bottlenecks? Are there places where there's duplication? So we take a look at and examine in detail how a facility currently uses the records and performs their tasks. Then we test the functionality. We use a test domain, typically, and we also involve the users in the testing of the new system. So it's usually called user acceptance testing, and the scripts or the process of that testing is usually what designs the training content, the curriculum. And create a timeline for implementation, and to do that we use the project management tools, which is such as a Gantt chart, and a Gantt chart will identify what steps will be done by when and how are the steps connected to each other. So these steps are listed with due dates and persons responsible for those steps, and also what is a dependency. So if I need to get this task completed but I'm dependent on the other task getting done first, they would be linked together on the Gantt chart. Next slide, please. What is required in a migration plan? First of all, investing appropriate time to develop the plan. The better planning, the better outcome. If you have a great plan in place, you're able to then be nimble with the plan, to tweak it, to adjust it slightly. But if you're still planning as you're implementing, it's very difficult to do that. So the appropriate time to get a plan in place enhances the rewards of a successful electronic health record implementation. A plan must be fluid, so if you've planned it well in advance and have a solid plan in place, then again you are able to be nimble with it. So you can react to things that were unexpected, things that you didn't think of, and you're able to adjust the plan accordingly and to manage those variances that come forward. The next step is a complete assessment to include periphery information systems. So if our power chart system, when we were implementing it, we needed to also think about our pharmacy system, our nutrition system, our radiology system, our lab system, and make decisions about integrating those systems and interfacing those systems. So what does this affect? And do we want to have sub-projects underneath it, so we have the integration of all the systems together. So that was also needs to be considered. In terms of a Gantt chart and a simple timeline with a Gantt chart, next slide please. Here is an example of one where you would have the task that needs to be completed, and very similar to a bar graph, it would just indicate how long it will take for that task to be completed. So with this one EHR project proposal, it was going to be taking from February to the finish time of September, looks like September the 13th. And again, if there was a dependency, that one would be attached to another line item and would indicate that dependency. Next slide, please. So in your booklet on page 301, in your textbook on page 301, there is a case to consider. So I'll let you do that on your own time. But it talks about preparing and evaluating and implementing a health record system and the migration plan needed to do that. It identifies that you need to think about what are the barriers that you might run into or the challenges that you might run into. As I said previously, one of the challenges that we ran into was the need to increase the skills of the physicians with their basic understanding of Windows terminology. So that was one thing that we hadn't really considered initially until somebody came forward. Also thinking about what were the any previous implementations that occurred and how did people accept them and adopt them? Were there the resistors? Were there the early adopters? Were there the innovators? And who were those people? And what are we likely to run into this time? So preparing for the future is very helpful in mitigating any resistance. But then you also need to think about who will resist, who will potentially resist, and how will you manage that? How will you bring them along? And if there's at the end point they're still resisting, how will you manage that? Is it enough to say we need to let the person go because we are implementing this system? Staff members, you have to remember, are going to be in a learning phase. So they're going to need to let go of the old and adopt the new. And the phase in between, in terms of change management, is very awkward. It's like getting a new phone. So you had your own old phone, you knew all the apps, you knew all the things that it could do, and now you've got a new phone and it's awkward and you're trying to learn it. In some cases, people go back to their old phones, and in some cases they just dive in and they learn the new applications and the new things that that new phone can do. So take a look at that case on page 31. Next slide, please. One of the crucial steps, in my estimation, is the analyzing of the workflow of the current state and taking a look at what goes on now, how can we improve it. So the workflow analysis is the review of the current organizational functions and the current use of paper. So who initiates the paper? Who writes on the paper? Where does the paper go? Who else interacts with that piece of paper? So the workflow analysis, you bring people together and you map out every single step of that piece of paper, from getting it out of the drawer or pulling it off the shelf, right to the very end, perhaps in filing it back in the chart. So it's called a workflow analysis, and it involves the front end and back office functions. So the front end would be if it's a family doc's office, that would be the medical secretary who might initiate the paper. And the back office functions might be the nurse or the physiotherapist, any health information management functions, so any need to report on the data, to use the data for financial reasons, and then of course the provider and the care processes of the physician and other healthcare providers. So the stakeholders that are involved in that workflow analysis are usually health information management professionals, physicians of course. Very difficult to get their time to do the workflow analysis, but really helpful in terms of future adoption. Nursing staff, of course, IT staff, and then various managers of various departments. So we need also leaders connected to to the project. They need to be knowledgeable about what's going on so that they can help and support either with the change or maybe getting something done in terms of a management level and their peers. So this is done, as I said, step by step. Who and what roles write on the paper? What does the individual do with the paper? Who touches the paper? Are there variations in the process? Are there times when the process gets stalled because I'm waiting for somebody else to give me something before I can move that paper forward? So does it ever get bogged down? Does it ever get stalled? And how long does the process take from the beginning to the end? Next slide, please. To do that workflow analysis, we usually use flowcharts, and they're commonly used in workflow. Analysis, and they help break down those individual steps. But they also point out where the process is inefficient, particularly if we're repeating steps. So they point out the inefficiencies and sometimes the bottlenecks. So we indicate on the flow sheet if there is a stall and how long that stall takes. So if I have to wait for somebody else to give me something, typically what's the average time that I would wait? So the flow sheet can often identify those. Next slide, please. The approaches used for workflow analysis is they tend to bring together people in a team from different departments. They assign staff to perform job functions. So one person is going to lead the meeting, one person is going to put the flip chart paper on the wall or perhaps do it on the computer. I've seen it done different ways. And maybe one person is going to take minutes, maybe another person is going to list all the things that we need to investigate. So it was called a parking lot. And so everyone has a role to play. We conduct the internal analysis sometimes by shadowing, by actually going to the current state and going through the process, being a fly on the wall, if you will, and just watching the person start the process from beginning to end. They use role reversal techniques by also stepping out of the process and putting themselves in the place of the patient. So instead of the staff and the clinicians and working through that process, they say, okay, if I was a patient, what would I see? And how would I interact with this process? So that's often helpful to get a full 360-degree picture of that process. They require staff members to construct detailed job descriptions. So what is it that you do, but is that what you're supposed to be doing? And the detailed job description would indicate what's supposed to be done. Sometimes work has evolved and we need to update job descriptions, and sometimes we are not doing what's actually on our job descriptions. It's sometimes called a workaround. We do other things that may be a little bit more efficient or maybe not as awkward, not as comfortable, and sometimes we need to get that back in balance. So detailed job descriptions of their routine tasks and actions and sequences of the job can also help inform the current state analysis. Next slide, please. The workflow analysis outcomes benefit the facility, staff, and patients. During the workflow, they take a look at all the forms used. So they collect them, they review them, and they ensure that all the forms are accounted for. They understand the content and the uses of the forms, so they need a person in the room asking why. It's often an uncomfortable situation when they ask why, because people tend to be very, very comfortable with the current process, what they do, and they tend to be not as comfortable when people are challenging. But it's so helpful to ask that why. And often that's the external stakeholder. If we have hired an external project manager, they're usually the person who's comfortable asking the why, because they clearly just simply don't know. But sometimes there can be reaction to that. So we have to manage that when it happens. The desired outcomes of workflow analysis include setting realistic expectations for software functionality. So some people want the best system ever, and the best system ever isn't out there yet. So we need to manage the expectations of the team to say, yeah, it would be nice if it could do this, this, and this, but we're not there yet. So you might be implementing a system like PowerChart, but we don't. But the organization really wants a patient portal portion to it, and it doesn't have a patient portal yet, or the organization can't afford that part of the program. So the organization has to look at what is realistic within our resources, current resources. Another goal would be to streamline the current processes and improve communication, of course, between individuals providing care to the patient, the Ministry of Health, who are the funders of the healthcare, and also, of course, with patients. So patient care is at the center, as we mentioned last week in the last video. With the CSWO and the eHealth initiative for the province, the patient must be always at the center of the care and the center of what we're doing. So we also want to coordinate treatment and improve the quality of the patient's care, which is always at the forefront. Next slide, please. So the next checkpoint, workflow analysis considers physician and stakeholder involvement, front and back office functions, health information management functions, and provider care processes, information technology and finance, and stakeholders. So the answer is listed there as all of the above. They do have all of those people involved typically in workflow analysis. In our organization, as I mentioned, with London Health Sciences Centre and St. Joseph's Healthcare, we also include our patient advisory committee, and thus patients will actually sit on some of those committees. If they can't sit on the committee in terms of attending the meetings, we definitely will connect with them via email and phone discussions to ensure that their voice is heard. Next slide, please. Selecting a vendor. So selecting a vendor is like getting a new member to your family. The vendor is so important in the implementation of electronic health record system, at least from my experience going through this twice before, when we initially selected PowerChart, and then also later on when we added the computerized provider order entry. So when selecting a vendor, an organization must appreciate that they are going to be engaging in a long-term solution. So not only the selection process of that vendor, where you meet them, they introduce themselves and they walk through what they can do for you, but then also the implementation. They're usually on ground zero. They're here. They're working hand in hand with you, and then they're there when you implement the system and sustaining the system, and then when you do upgrades as well. So it's very costly to use another system to get features that you want, rather than just add to the system that you currently have. So it is a long-term relationship. The vendor selection must be thoughtful and must include all necessary employee representatives. That is difficult to do because it can be many stakeholders, but so important to do, and to make sure that we've included them, that their thoughts have been conveyed, and we're taking their work processes into consideration. Organizations may find value in hiring an outside consultant to assist with the vendor selection, again for that objectivity. And we may not have the resources internally to do the vendor selection and to manage that as a project, and so quite often you can outsource that. Locally, when we implemented the computer provider order entry system 4 years ago, we used Deloitte, which is a company we use them to assist us with the project management as an outside project manager. But when we were doing the vendor selection, we used a company called Healthcare Materials Management System. So they're the company that already does all of our supply chain in the hospital. So all of our materials from paper to scopes to instruments to medications, they already work with many vendors. And so they have those skills. So we brought them in to manage our vendor process. Organizations may also choose to build their own system using several different applications from different companies, and that can occur. We didn't use a Cerner radiology system, and I don't even know if one exists, we used a GE system and interfaced it in with Cerner Power Chart, as we did with other systems like Muse for the cardiology system. So sometimes it's a complete one-stop shopping system that'll do everything, but if they're not out there, sometimes we will have to add those extra systems so that the information is interfaced and interoperable. Next slide, please. As a steering committee may consider the following when selecting the vendor. Does the vendor have the right supports in place? Do they have the financial resources to do this and the capabilities to meet the organization needs? So do they have enough people that can come on site and assist us with this? Are they flying them from across the country or in the nation? So what's their current state? How ready are they to able to help us with this implementation? What would they provide? How many staff would they provide? How long would the staff be there? How would we interact with the staff? Are they having offices or desks in our organization? Or